Hello everyone, happy Friday. Once again, my name is Lily. I'm a physical therapist and welcome to the 12 days of Christmas. Starting today, we're going to talk about brain injury, traumatic brain injury. So let's get on it. What is a traumatic brain injury? A traumatic brain injury is an alteration in brain function or other evidence of brain pathology caused by an external force. Now, we know that the leading cause of a traumatic brain injury is usually a fall, but it could be caused by struck by motor vehicle accident, assault, or any other causes, okay? So it's usually more commonly seen in males. There's a 3-to-1 male-female ratio in traumatic brain injuries, and the highest incidence is on people older or that are 65 years of age. So, and usually, again, the leading cause is falls. Now, if we're talking about ages 5 to 24, or early 30s, we're seeing the motor vehicle accident as the cause of a brain injury. Okay, so now we're going to talk about the types. So we have the open and the closed. The open head injury is the one that the object penetrates the skull and enters the brain. And we have the closed head injury, where the external force or the violent movement will cause the brain to kind of knock against the skull, causing the brain injury. Now, there are 5 types of brain injury. We have the diffuse axonal injury, which this is our shearing of axons because of that twisting movement of the brain. Very, very severe. When you see in the chart, diffuse axonal injury, you should think, ooh. We have the contusion, your typical like bruising on the brain. Coup contre coup, which is when the brain hits and then hits back. So it's hit in the front and in the opposite side when you have a contre coup. Okay, and then we have a penetrating injury and the hematomas. So the hematomas, in my own experience, have been like I've seen hematomas in people who have fallen, like they have the subdural hematoma, things like that. So hematomas, you have the subdural. Well, let's start with the most outer: epidural, subdural, and then intracerebral. So if you're talking about epidural, here there's a mass of blood between the skull and the brain, and this type of hematoma causes an increased rise of intracranial pressure. So this one needs medical emergency right there. Like, you need quickly medical emergency. For subdural, it's a bleeding between the dura and the subarachnoid meningeal layers, associated with blunt trauma without the skull fracture. Now, something that I forgot to say is with epidural, usually is associated with skull fracture and the increasing intracranial pressure. That's epidural. Okay, subdural, it's not usually associated with skull fracture. And then we have intracerebral. And the majority of intracerebral hematomas happen in the frontal and temporal lobes, okay? Now, those are the primary brain injuries, Now, we can have the secondary effects of the brain injury. Could be intracranial pressure. Remember, your intracranial pressure should be between 0 to 10, okay? If it's higher than 10, usually it's considered kind of high, or high if it's more like 20 or 16, things like that. A nurse once told me if you have higher than 16, then you should be considering very, very high. You can have hypoxia and ischemia because of the brain injury. You can have edema, you can have infection because of the penetrating. The open injuries are more susceptible to infection because, you know, the object enters and yeah. Post-traumatic epilepsy and hydrocephalus. So all of these are secondary causes of brain injury. Okay, so lastly, what I want to talk about is the Glasgow Coma Scale. The Glasgow Coma Scale is a scale that is going to classify the severity of your injury. So remember that we had the lowest score that you can get here is a 3. And if you have a 3, so the lower the score, the more severe your injury. So this score is from a 3 up to a 15. Now, if you're not familiar with the Glasgow Coma Scale, this is going to assess eye response, verbal response, and motor response. So in general, let's say I'm going to give you an example with eye response. You're going to look if your patient opens their eyes spontaneously, opens the eyes to speech, to pain, and then for verbal, are they making like noises? Are they speaking like inappropriate words? Are they speaking like oriented to time? Are they? So that's the verbal. And then for motor, it's usually if they are in decorticate, decerebrate, are they withdrawing to pain? Are they localizing to pain? Are they obeying your command? So things like that. So you should check the Glasgow Coma Scale if you haven't, because this one is really important that you know if you work with brain injury, especially in the acute care setting. Okay. All right, so that's for intro to brain injury. So tomorrow we're going to talk about what happens in the brain when you have a brain injury or a concussion, because it applies to both. And then we're going to review that. And then the third day of Christmas, we're going to start talking about the Rancho levels. See you next time.